The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. We have a nice little episode for our fertility series, and today we get to talk about acupuncture for fertility. So we have the lovely Sadie Minkoff here, and we're so excited to have her talk to us about this. Thank you for being here.
Yeah, my pleasure. I love talking to you too.
We're really excited to learn about this. We've had clients telling us for years that they have done acupuncture, either like in conjunction with fertility treatments or just to like prepare their body. And honestly, before I became a doula, I didn't know a whole lot about acupuncture at all. And acupuncture for fertility is still something that I don't know a ton about. So we were just saying before the recording started, we're excited to like really get to learn about this together with our listeners. So to start us off, can you tell us, how does acupuncture work in preparing the body for pregnancy, both physically and emotionally?
Yeah, I'm glad that you mentioned both because we really don't separate the health or the body into the emotional, mental, and physical. Everything is intertwined in our view and in our experience. And so we can talk about how acupuncture supports reproductive health in general and fertility specifically in a few different ways, a few different terminology, language, because acupuncture is the longest unbroken form of medicine. And when I say acupuncture, I really mean traditional East Asian medicine or traditional Chinese medicine, because it encompasses a lot more than acupuncture, the tool of acupuncture. It's an entire philosophy, medical approach to healing, view of the world. And so when we think about it with the lens of our modern life and approach to medicine, we know that it does some things that are very beneficial. So let's start there. Yeah. It influences the nervous system, which has broad impact on the body, right? Because our nervous system is the communication. It's how we receive information, how our body processes that information, and how our system innately responds and chooses how we're going to heal, how we're going to be strong, how we're going to move forward. And so that alone does things like increase circulation. And acupuncture has been shown to increase uterine artery perfusion, which means blood flow to the uterine artery, which includes the uterus and the ovaries, which has then further been shown to increase egg quality. We believe that that is because the egg is nourished by follicular fluid. And so we have the egg that is in the follicle, that is
follicular fluid. I can't, like, that just stuck in my brain, like follicular fluid. Such a great little word.
It's such a great word. You're going to have to just jump in and interrupt me because I
love that. No, I had to, because I was like, those two words, like, that just sounds so funny, right? It sounds like something made up, follicular fluid.
Yeah. Think about an egg, right? When you eat an egg, right? You see the different parts of it. It's pretty cool, right? And they all play a role. And so, I think I'm going to finish that thought and come back. Okay. So what it does, nutshell, it increases circulation, which is so important for reproductive health. It reduces inflammation, which is the root cause and or the byproduct of so many medical issues and disharmony in the body. So we can support the immune system and support reduction of inflammation. We can support balancing hormones, right? Acupuncture increases the likelihood of ovulation with people who, for example, who have PCOS, who don't ovulate regularly. It regulates the menstrual cycle and so many underlying issues that contribute to delayed conception, not to mention stress, which influences reproductive health, but also delays in conception influence stress. I don't think dare I say, I've never met anybody who wasn't impacted by this process because it's so intimate, it's so personal. And when there are delays and it becomes very medicalized, it's very stressful. So that's sort of what it does from a Western medical perspective.
Yeah.
And then we can talk about how we view it from a more traditional place as well. But to get back to follicular fluid.
Yes.
I love to hear it.
I love it too, because really, I think this is something that we don't pay enough attention to. And now people meaning physicians, are starting to think about this as a real influential piece, right? Like the nourishment of the follicle. If you have a puppy, we were talking about puppies a minute ago before we got jumped on here. And you nourish that puppy and you feed it and you love it, it's going to be a very different dog than if it's not well fed and not cared for, right? And so one of the biggest issues and concerns when it comes to reproductive health, one area, is egg quality. Okay. And ovarian decline is what it's called. This is due to many things. Some of them are just sort of not pathology, it's just nature, which is age. And, I hate to emphasize that. I don't emphasize age in my practice because I think that we have such an amazing potential to heal our bodies and to support reproductive health. And yet we do know that it is a fact, right? Like somebody at my age is not going to get pregnant. I'm deep into my 50s, right? Whereas somebody in their late 30s, early 40s, they have an opportunity to really turn things around. You know what I mean? And really support that process. So along with age, there's a decline in ovarian reserve and eggs that are potentially viable. They have chromosomal issues that will then end in not conceiving or in a loss, or in, some of them go on to be like Down's babies and things like that, right? So there's a higher instance of that. And so what we're looking, like, nobody can change that. If things are already chromosomally abnormal, that is what it is. There's nothing any doctor, any acupuncturist can do about that. So where we feel like there is a lot of room for support and growth is in that maturation process, right? So that they are nourished and so that potentially viable eggs are not going awry. Okay. So are you okay if I keep going? Okay.
Yeah, this is amazing.
Okay. So what happens is in the maturation process of these eggs, so we meaning people with ovaries, have all of the eggs that they're ever going to have before they're born, right? So all those babies that you see popping out, they're all there already. And then
I think a lot of people don't realize that. And they finally one day hear the little weird thing about like, oh, your child was actually in your mother. And they're like, what? And it's like, yeah, because when your mother created you or your parent created you, in their womb, you were formed. And then in your body, that other baby's body, like of the egg, was already there. And that is such a wild consideration that we've been carrying them around that long.
It is wild. Just to pause and think about that, like think just intergenerationally, all the influence that happens, right? Just another plug for like taking care of ourselves. We are literally taking care of our children from the moment we are born. It's nuts, right?
Our
So,
bodies are crazy.
yeah, the body is so crazy. I mean, I could tell you, I love this stuff so much. So I have lots of little nuggets like that. Um, so, so then, puberty happens and we start to sort of, go through being able to conceive, and that continues until menopause, right? Um, so as we are growing eggs, really your whole life we could look at and say, well, what's happened to you? Okay. I read something the other day that was also sort of stunning and made sense to me. You can't quote me on this, but I did read that a study that showed that women who had been in abusive relationships went through menopause years earlier, right? Like everything influences reproduction, and we have to be strong and healthy to have the resources because fertility is not vital for our lives. It's extra. So everything else, and this is a very holistic perspective, we need to nourish and care for and be solid enough to devote energy to fertility. That doesn't mean people in war zones don't have babies because they really do. But if you are having delays, I think it's the wisest thing to take a step back and look at the whole picture. Like what is going on in my life, and what influence can I have over
Yeah, I
this?
think that's a struggle that some people have. They're like, when they're going through an infertility journey, they're like, how can people that are in war zones, like, I'm trying my best to do everything and it's not working. And then there are people who have unplanned pregnancies and they're not taking care of their body, or they are in a war zone, or they have addiction or substance abuse disorders, and they're having babies. So that is such a hard thing to wrap our mind around because we never want to place blame on, well, your environment's good. Well, there's so many people in poorer environments that are not thriving, that are having babies. So I'm glad that you touched on that because I think that's really important.
It's so important. And so what we're looking at in our practice is how to support people throughout this journey. And also, what can we influence? Because there's a lot we can't. Like we just said, you have had your eggs hanging out since before you were born, right? So that is, and we really work with that a lot. Like because when there aren't easy answers, most people are going to blame themselves, and that is it's a challenging place to be, and it deserves some real care and support.
Yeah, absolutely.
So, um, so that process is happening, and eggs start to sort of come out of hibernation many, many months, debatably 9 to 12 months before they're going to ovulate. But the last growth spurt of maturation, where there's a lot of rapid cell division, happens about 100 days before an egg is ovulated. Of course, there are exceptions to that rule, but that's the general case. So 3 to 4 months of support when preparing for pregnancy, we can really influence that process. And that's why we believe that our work shows better outcomes, better ovarian reserve, right? So that's sort of that piece.
That's awesome. I've never thought of, I've never even considered that, but that's really cool.
Yeah, that makes sense.
Yeah.
Yeah. So when people are supporting, like some people start with acupuncture or some people start with IUI or IVF or something like that, what is kind of the combination that you think is, I don't even know if you can answer this, but what is the combination that you think is best? Is it best to do all of them in conjunction, or like IUI and acupuncture at the same time, IVF and acupuncture at the same time, or would it be worth it to just start with acupuncture?
Yeah. So we are very detailed and very meticulous and very individualized when it comes to our practice. So we want to give each unique person with their unique situation guidelines. That being said, when we're talking generally, it's ideal if you have time and your situation, allows you to start with acupuncture, that is the gentle way to go, right? So that's how medicine should always be. If you have time to do things appropriately, do that, right? And then, 3 to 4 months of support before you're actively trying to conceive is great. Most people that come to us don't have that. They've already been trying for a really long time. And so then we're looking for strategy. What is the best for your unique situation? A lot of people are trying naturally when they come to us, but we have a huge amount of people that are already engaging in assisted reproductive technologies like IUI and IVF. So when it comes to recommendations about how to integrate those, if people are preparing, let's say for an IVF, okay, which is where, for your listeners, right, they do a super ovulation where they give lots of medication and grow as many eggs as possible. Usually in nature, we ovulate 1, maybe 2 every cycle, right? Here we're looking for like more, right? As many as possible. I've had people have none, but we want like 10 or, so 15. And I've had people go all the way up to like 50 eggs retrieved, which is extraordinarily, right?
Wow.
Right. But so as many as possible, they halt ovulation, they go in and retrieve the eggs and then fertilize them outside of the body with sperm. They watch them mature, it's really valuable. It's also diagnostic as well as therapeutic because they can see, things are not maturing up to this point. This is where the problem is, right? The goal is to get them to be day 5. Embryos is you most common. Then they send them off for genetic testing. So they can literally say, we are almost certain, not completely certain, that this is a genetically sound embryo. And then they grow the uterine lining, which is what every month is shed and becomes your menstrual cycle, to the right amount, which is, they want it to be 7. And then they implant the embryo. 1 embryo is the vast majority of times. And then hopefully somebody is pregnant. So that's the process. So the egg retrieval part, that first part of growing and retrieving, is all about egg quality. And so that's, acupuncture really shines in light of that. And obviously you can tell just by that little bit, this is a stressful process. It's a marathon for your body and for your, emotions. So we support people through that. If somebody has time to prep, we get them really strong. It's literally like going into a marathon without training. We don't want that. We want to be ready. So we do that. If they don't have that, we start where they are, right? And pick up exactly what's going on. Then the transfer, when they're putting the embryo back into the uterus, we like to prepare for at least a month before then. Remember, we said increases uterine artery perfusion. It's all about the uterus being receptive at that point, right? Reducing inflammation, increasing circulation. And so at that stage, we're really, wanting to prepare. And so studies have guide our right, we're a very data-driven practice. So there have been studies that show that twice a week acupuncture for the month leading up to a transfer. So that includes the time where they're preparing the uterus with medication. And then treatments around the actual transfer itself, the exact same day as the transfer, increase success rates. And there was a study in 2022, thousands of people. They did the pre and post transfer, and it showed an increase in live birth rates, not just biochemical pregnancies, but live birth rates by 55%.
Wow.
Holy cow. That's statistically significant.
It is. And there have been multiple studies that show that. And that is really just about that implantation window, right? So do you like sciencey stuff?
I do, but Sam loves it.
Okay.
We love the science. Let's hear it.
Yeah. So what happens is, this is, again, most often an embryo that has been growing for 5 days, right? And so if you think about what happens in a natural conception. You ovulate, sperm and egg meet in the fallopian tube and hang out there for days. And then many days later, it sort of makes its way into the uterus and implants. So we don't know when that's happening. So in something like natural conception or an IUI, which is just where they introduce sperm to the uterus, right? And then let your body do its thing. So we don't know when implantation is going to happen, so consistency of care is really what we're looking for there, right? But with an IVF, we know that implantation is going to happen imminently. It could happen that same day as a transfer. So we want to utilize that information and intervene and support implantation. So we do a pre and post transfer treatment.
That makes sense. So a lot of like data driven, like this is the day, we know exactly when this is going to happen. This is what we're going to do to prepare for it.
That's right.
Yeah. I love this, like those numbers, because there are people who just are like, I just don't know if it really works. And I was one of those people. And I was the same way about chiropractic care until I did it myself. And then I felt the difference, but I didn't know what the statistics were. But a lot of people think that these things that are less medical are not effective. And it's like they don't believe in herbs until they're like, oh, well, it says not to use this in pregnancy. So it must do something if you're not allowed to use it, And with acupuncture, it's like if it's showing that it's a 55% difference in that, it's working. My husband always says all of this is like, we're crazy, like chiropractic, acupuncture, all of it. He's such a skeptic on all of it. But it is kind of hard to believe. It is kind of a woo-woo thing for some people or whatever. But it is science still. It is still science and how it works with the body.
Yeah. Yeah. And I love medicine. I love helping people. So I don't really differentiate, but I can tell you, we need everything. We need all our resources because people need help, And so Western medicine really shines in some areas and we really shine in other areas. And why wouldn't you use all your resources? To be fair, in China, they use acupuncture integrated in all the hospitals, and they don't pay for things that don't work.
Right.
They've done lots of studies, and not to mention in population, they're things don't last if they don't work. This is thousands of years of clinical documented evidence from generations of people. So it's, I think that the mistake is thinking that one way is the only way or the best way. It's really the appropriate medicine is what should be utilized, in my opinion.
So are there any, we like to talk about like the medical side of things, and we're talking about medical things. We talk about benefits and risks. Are there any known risks to using acupuncture?
Yeah. So there are some very minor risks that actually might happen. People might get a little bruise. It is a needle. We are interacting with the body, and you could nick a little capillary or something like that, and there's a little bruise there, or a little histamine response that gets a little bump, but that should just resolve quickly. Sometimes when we increase circulation, people get a little lightheaded. We really make sure everybody eats before they come in because of that. So we have drink boxes in our office for that, but it happens maybe once a year, if that, right? And thousands of treatments that we're doing. So those are very minor things, but those are the things that you could actually expect to potentially happen. Bigger things that have happened, and to be fair, vast majority of times they're happening because people are not trained acupuncturists that are doing this. There are other modalities that are doing something like acupuncture because they can do it legally without very much training. You can puncture organs, right? That's pretty much it. So,
the word of the trade. Acupuncturist, please. Licensed acupuncturist, please.
Right. I don't know anyone that has ever happened to.
Yeah. Kind of an out there risk for sure. But it's always good to know. But for the most part, if you are working with a licensed acupuncturist, there's not really going to be a downside to using acupuncture.
Very, very gentle and very safe. Yeah, with very few side effects. Yeah.
I'll say for myself, I never used acupuncture until I was pregnant with my daughter. And I was terrified of it because I'm not a needles person. I'll get tattoos, but I won't. I hate shots. I get real fussy about them. I'm a child still. But I was really nervous going into acupuncture, and it was so nice. It was just the most relaxing experience. I was 30 something weeks pregnant and miserable, and it was just so amazing. And after that, I was like, gosh, I wish I had been using this for, so much more of my pregnancy and even beforehand. I think it really would have made a big difference in my just general existence.
Yeah, I will say that because it's been utilized for so long in so many different cultures, it has taken on different modalities, different theories, different ways of practicing. And so Japanese style acupuncture is different. Like in our culture, our Western culture, it is a little bit different than in some other places. So depending on who you see, they might emphasize certain things or utilize different tools or who they are as a practitioner. I mean, you go to different doctors, it's a very different experience, right? So sometimes you do have to sort of say, oh, I'm going to try somebody else. Do you know what I mean? But yeah.
Yeah. So what advice would you give to someone who's considering, maybe they're on the fence about it or whatever, as having acupuncture as part of their fertility or pregnancy journey?
Yeah. I think that I would say, put your foot in, your toe in the water and
Why
see
not?
what it is.
Yeah.
Is why not? And truly, the thing that I hear the most often from people is that I wish I had started it earlier, right? Now I'm knee deep in this process and I'm overwhelmed and I can't go back. And so preparing yourself well for either a successful, happy pregnancy, take home baby, or any kind of intervention that you might need, is going to not only support outcomes, right, but it's also going to support how you move through that emotionally.
Yeah. Yeah, I will say that's something that we hear across the board from our clients that we serve as birth doulas is with whatever it is, even if we give the advice upfront, once they try something, once they finally go with whatever, recommendation we had given them, it's almost always, I wish I would have started sooner. And in this situation, when you're talking about fertility, a lot of people don't have time to do anything sooner. Like, some of the things we're hearing, they're already pregnant. And so it's like, oh, I wish I would have done this sooner because I feel better, or I wish I would have done this sooner because my outcome of having this baby flip would be higher or whatever. But when you're talking about working on a time clock, whether it's because of age or whatever, and you're spending so much money on fertility treatments, it's like, why not just do this one extra thing? Yes, it can be an investment, but when you're already that far, it's kind of like when you're playing poker, you're like, I already have so much in the pot. I may as well just add this little thing now because it's not going to harm and it can help.
That's right. And so, 1 in 4 couples, people will not have to repeat an egg retrieval if they incorporate acupuncture, right? Wow. So if you think statistically just about the financial input, it's well worth it. I will tell you that I know one doctor in town who always tells her patients, acupuncture is great if you can afford it. And this is somebody who is like, their treatments are ridiculously expensive. This is like, a tiny little amount compared to that,
Yeah. It is hard though, when we're looking at like the general financial impact that a pregnancy can make, or trying to get.
I don't mean to diminish.
Yeah. But
it's all a lot. Right.
But if you think about the emotional too, like
Absolutely.
The emotion that goes through and what your body goes through when you're going through these treatments in order to do an egg retrieval, it's not easy on the body. So not only is it not easy on the pocketbook, it's not easy on your psyche, your physical well-being. Mm-hmm. Sometimes the medicines they're giving you make you not feel very good. So if you can do one more thing to help it not potentially not have to do this again and it raises your chances statistically, then for me, I would say it's worth it. But hey, everyone their own, but I think that's really great advice.
Or even to use, or even to do before you have to get to IUI or IVF. Like I'm thinking back to my first fertility journey where I tried they told me I probably wasn't going to get pregnant. And I tried for almost a full year and was about to have to go into those fertility treatments. I wish that I had known about acupuncture way back then when I was in my 20s and, was being presented with this information. I did end up getting pregnant on my own, but I had 11 months of pretty intense, emotional distress of well, here's my body failing me again. And maybe if I had done something like that, it would have made a difference.
Yeah. We have lots of people that come in and they're on their road to interventions and then they get pregnant,
Huge. That's huge. I love it so much. This was so great. I know there's this is such a huge topic when we're talking about just fertility in general, which is why we're dedicating this much time this summer to this. But I think, especially when it comes to acupuncture and Eastern medicine and all of these different approaches, there's so much that we could cover. But I think this gives people a really good glimpse into what this can offer you and what, kind of the risks and benefits of acupuncture can be. And we're all about that. So thank you so much for coming on and sharing this with us. I think this is huge. And I just know people are going to love it.
Yeah, my pleasure. And honestly, the part of my work that I love the most is the more holistic aspect, that we're caring for the human being in front of us and helping them get through this, as we've said again and again, a very difficult journey, while at the same time always keeping our eye on optimizing their reproductive health.
I love it. Where can our listeners go to learn more about you, about Sage, and the services that you offer?
So our website is the best place, which is reproductiveacupuncture.com or sageacupunctureaustin.com.
I love it. And we'll make sure we link those in the show notes. Thank you so much for coming on, Sadie. This was fantastic.
Thank you both.
Thank you so much.
Take care.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.